One of the biggest challenges today is how do we manage medical gases in surge population environments. Now, surge population can be an overflow of patients from any number of reasons. It can be just daily afternoon overflow in your ER. It can be a mass casualty incident. It can be a pandemic. It can be any number of things, bad flu season to be another example. But how do we manage it without compromising the infrastructure of what we have on the wall, right? Our basic code has very minimal requirements when it comes to standard patient rooms or emergency department exam rooms. Right? It doesn't give us a lot of flexibility to surge up. So one of the very easy answers is to install an equipment management system by Paladin on your rail in those rooms where you would pre-designate them as alternate care locations. The new FGI guidelines, the Facility Guidelines Institute for Emergency Conditions, is going to require healthcare facilities to pre-plan for alternate care sites. And again, this is something that can easily be done in those identified areas and put a rail up. What you do with that rail is very simple. We can take accessories of medical gas blocks, as they're called, and we can install them onto the rail simply by the click, and then attaching a hose to the existing gas outlet. And now you have 1, 2, 3 supplemental outlets from one outlet without going and compromising the integrity of the existing wall outlet. Because when you put splitter blocks and Ys on the wall here, they will compromise the integrity of the outlet in the wall, and then you've got long-term damage and costs. But now it's even better. You can go from this and you can add additional blocks for even more services, and the length of the hose will determine where your blocks are going to be. We can add additional outlets, and we can daisy chain these as many times as we want until we have, in this case, 1, 2, 3, 4, 5 gas service outlets. They can be flow meters, they can be check valves for ventilators, but now you have, within seconds, expanded your medical gas capabilities to meet just about any surge requirement that you may have come in the door. So one of the other challenges is how do we expand vacuum under a surge condition. We don't do it the same way as we do oxygen because it's very difficult to daisy chain those gas blocks because we lose the vacuum pressure. So what we do is we have something called the splitter block. The splitter block is something that goes directly into the wall outlet and is secured the same way. And by the way, this can be any flavor of gas outlet, DISS, Chemtron, Omeda, doesn't matter. And we have 2 discharges. Now with these discharges, what we do is we'll take our gas blocks, same as we did with the oxygen, and we'll mount these to the rail, and then we'll bring a hose over to the individual discharges, and then we can add a second one, and you'll note this one has a Chemtron just for demonstration purposes on it. And now again, in a complete non-invasive manner, we have added 4 vacuum outlets to a single wall outlet in a matter of seconds, without damaging the infrastructure of the wall or compromising the integrity of the vacuum system. And based on the length of hoses, you can spread these out left side or right side of the bed, but it gives the users the ability to do that on demand at the time of a surge event occurring. Paladin Healthcare, if it's on a wall, it's on a rail.